This is Dr. Whiting, and today I want to talk to you about something that is at the heart of most all chronic conditions that people suffer from: arthritis, diabetes, heart disease, prostatitis, prostate inflammation, PCOS in women, etc., etc., etc. And that is inflammation. Inflammation, or the inflammatory response, is something that can be a lifesaver. If you injure yourself, let's say you twist your ankle or you sprain your wrist, acute onset inflammation will swell that area up and make it very painful. And nature's doing that so you don't keep walking on it or using it and damaging it further than it already has become. That's where inflammation is a lifesaver. When inflammation occurs acutely and severely, it also can contribute in the short term to the healing process. So nature isn't dumb. It generates the inflammatory response because it knows what it's doing. However, when inflammation is present chronically all the time, say, for example, such as in arthritis, then that inflammation over time can actually contribute to the detriment of the affected area. For example, in arthritis, if you have arthritis in your shoulder or your knee, and that's constantly inflamed and red and swollen, and it's not only producing pain, but it's slowly deteriorating the joint and connective tissue. So controlling ongoing inflammation is somewhat important. We often control inflammation in a variety of ways. Most of us use over-the-counter anti-inflammatories. That would be ibuprofen, that would be naproxen, and there are several others. And they're very effective. Depending upon how severe the chronic condition has become, they may, over time, not be sufficient to manage the inflammation and hence manage the pain. If that is the case, then oftentimes your physician will prescribe something a little bit stronger and a little bit more aggressive. Unfortunately, those more aggressive painkillers also have more aggressive side effects, as it were. Then the next category of pain is called, or inflammation rather, is called silent inflammation. That's the inflammatory response that's producing an irritation below your pain threshold, so you can't even feel it. And it is that, what we call silent inflammation, that contributes to ongoing diabetes, heart disease, and liver disease, inflammatory bowel disease, hemorrhoids. The list goes on and on and on. And you can almost always find silent inflammation, at least in part, at the root of these problems. And because of that, silent inflammation is oftentimes far more dangerous than any other form of inflammatory response, because we don't know what's going on. So we go about our merry way, and we ignore what we cannot feel, and we don't think about that. And so that silent inflammation, slowly but surely over time, can degrade and deteriorate internal systems, organs, connective tissue, and so on throughout the body. One of the best ways to control silent inflammation is through a natural means. Because it is not yet severe, silent inflammation can oftentimes be controlled by natural substances such as methyl sulfonylmethane, boswellia extract, and of course more recently, people have become aware of the anti-inflammatory benefits of turmeric. And when you combine those ingredients together, you oftentimes can come up with a natural program to help control the silent inflammation you can't feel anyway. And in doing so, it may just give you the edge that you need, that we all might need, in order to help prevent the internal compromise of our bodies. It's a simple thing to do. Those supplements are available everywhere. And in fact, I formulated one myself. And it has become very, very popular because of its combination and its effectiveness. But silent inflammation, along with chronic and acute inflammation, has its place. But over time, too much of a good thing is not a good thing.